Joining us to dive deeper into that topic, we have Ashlee and Becky, both registered nurses of 52 Beams with more than 30 years of experience between them. Let's explain why this month exists in the first place. Why is it so important to try to build that culture of support?
For so many years, breastfeeding has had such a negative stigma attached to it. People who, think that breastfeeding is inappropriate or who think breastfeeding is off-putting, especially when breastfeeding in public. But we have to remember that our bodies are designed to feed our babies. And I think it's also important to help women feel empowered and confident and comfortable.
We see different ethnic backgrounds all the time, and so they might have different points of view on breastfeeding and what it means to them, and we just like to embrace whatever that journey means for that mom. We want to be there to support you.
You mentioned confident and comfortable, two things that if I go back in time, I don't think I was either of them. So for the woman who is in that phase and it's not feeling natural or easy, what do they need to know?
People think that it's like rainbows and unicorns because it's natural. So we love to tell people just because it's natural doesn't mean it's easy. It's definitely an art you both have to learn, and with mom and baby there comes a lot of education. We like to tell people too that just because you took classes and you watched videos doesn't mean baby did.
But that's where we come in to help these moms to go through the different stages of breastfeeding with them, especially right at the very beginning. So many of our patients will tell us that they didn't realize that breastfeeding was going to be this hard, and when you have your support system, your friends and your family telling you how natural and easy breastfeeding is, and we all know that it's not like that typically.
We should address kind of the elephant in the room right now. A lot of people are going to social media for medical advice, the comparison game. What should moms know?
Dr. Google is not the answer. I would say learn from the people who have the education. Your doctors went to school for a long time. Nurses went to school for a long time. And we learn these things so that we can educate our patient. And everybody who does our job and in the medical field, we all have a desire to help people, but we have the education to back what we're saying. Anybody on social media can say anything they want to, and you can believe them, right? And so getting on there and saying what you think is right may not be the right thing for everybody because it's not evidence-based.
When you're watching TikTok and you're seeing that this mom is maybe pumping gallons of breast milk a day, and here you are only pumping a few ounces, that can be very difficult for, especially for a new mom going through that postpartum phase. And so as registered nurses, we would encourage our patients to stay off of social media.
Let's talk a little bit about your approach to postpartum care, because 52 Beams does things a little bit differently.
So for postpartum care, we come into your home and meet you where you are.
In their own environment, on their own couch, in their own bed, in their nursery where they're going to nurse their baby, wherever they're going to be most of the time. They don't have to bring their baby out because, when you're a new mom, you feel like you have to bring everything but the kitchen sink with you now.
Yes.
But you don't have to bring all that stuff to a cold office that's not conducive to specifically to you, and you might be in a setting of 5 other people, 10 other people in the room with you. Been told time and time again like how much they love and appreciate that we can come to them, especially if they live an hour away from the hospital setting. Who wants to drive an hour with a hungry baby to feed them when they get there, and so we love going into people's homes and we feel like we're just meeting new friends, honestly.
All right, if you want to learn more about Ashlee and Becky and their services, the website is right here on the screen. Where else can people find you?
We love to get social, so we're all over social media. You can find us there, but our website is great, and they can book an appointment straight through our website. We do take most major insurances, which is great. We have gift cards available for the mom or the aunt, the grandma that doesn't know what to get for the baby shower. We have gift cards available. People can always reach out to us.
All right, thank you for joining us.
Thank you so much.